Hello Malaysia and welcome to episode 8 of Medical Today with me, Jared Ratnam. Well, the purpose of the show is very simple, to improve health and to enhance lives, and we certainly hope we've been doing that. We're now currently within season 2. Now, we always start off the show in season 2 talking about well-being and aging, and a person who got us started on this is none other than Dr. Navendra Nagaswaran. He's the Group Medical Director for Global Doctors. He joins us on a weekly basis right here on season 2 of Medical Today. And today we want to talk about heart well-being in aging. And joining him is Professor Dr. Imran Zainal Abidin, a senior consultant cardiologist with over 23 years of experience in the field, and he's currently with University Malaya Medical Center. Gentlemen, welcome to the show. We have our usual suspect. Yes. And Doc, thank you very much for taking time off your busy schedule. I know what's like at UMMC. We've interviewed a lot of doctors from there. Well, we're very honored to have you here today. Thank you very much for joining us. So we're going to talk about the cardiovascular system and aging. Now, Dr. Navin, why are older people most susceptible to cardiovascular problems or diseases? Let's start off with that. They say as you age, you develop cardiovascular diseases. So why are older people, is it right for us to say only older people are susceptible to it?
Not necessarily. I think it starts from the age of 45 onwards, or even lesser for heart disease. But generally, the heart muscle, the arteries, as you grow older, they seem to get into a lot of pathology, which we will go into the depth shortly.
Right.
But also other predisposing conditions like the ones that we discussed earlier, NCD, diabetes, hypertension,
we've
cholesterol.
discussed the smorgasbord of diseases and sicknesses. So when we talk about the cardiovascular system, Prof, I'm going to come to you now. What are the effects of aging on the cardiovascular system?
Okay, naturally, when you are born until you die, and here if you die at an old age, there will be some physiological changes that happens to the person. That some of them may be normal, but if you reach a certain age and the change is overwhelming, then you will start to have diseases. Those that I'm referring to would be the most starting example is the hypertension, it's the blood pressure. As you age, the blood pressure will go up, but it comes to a point when the blood pressure goes too high, then it needs to be treated. At the age of 70 and above, more than one third or 2/3 of the patients will be hypertensive.
Right. But is it a normal process for our BPs to go up as we age? Dr. Navin, you can weigh in whenever you want, Prof.
Yeah, it is.
It
You're supposed to have higher blood pressure
as we grow
as
older.
you age. But if it exceeds a certain level, then it's detrimental for the person. So nevertheless, even though it's physiological, you need to bring it down to a lower level so that you live longer.
Right.
See, there is an upper and lower. There's a diastolic and a systolic. The systolic is when the heart's contracting. The diastolic is when the heart's relaxing.
So systolic is when the heart's contracting. Diastolic is when the heart
is relaxing.
So
you have a norm that's 80 millimeters mercury would be the standard for any age group. But then your systolic varies. Maybe Prof will go into a little bit of that.
So as you age, especially above 65, hypertension is always that systolic and diastolic. But above 65, the diastolic naturally will start to come down. So that
so the bottom number starts to come down.
Yes. So it becomes not a problem anymore. But as you age, becomes a bigger problem is the systolic. So it will go up higher and higher, and that is the one that contributes to death. The Malaysian guidelines have, in the year 2018, they have set up a cut-off point for treatment of what's considered as normal. For those above 80, it should not exceed 150 systolic. And those slightly younger than that.
So it's interesting that he says Malaysia. Is there a Malaysian guideline and world guideline? Are there? There are different guidelines.
There is different guidelines for different countries, different areas of the world, basically.
Why is that?
Okay, so in US, if you look at US guideline in 2017, they have set up a cut-off point of 130/80. based on their own data, their own
They've
research
collected.
on Americans, Europeans, and they have decided lower levels. We Asian, we are just made different from the Caucasians. So we believe that we should have our own set of guidelines for our own race and Malaysians. So that we don't, if you aim blood pressure too low, then you can have a lot of these old people falling off from low blood pressure, orthostatic hypotension. You know, they stand up and they fall down because of the low blood pressure. So we do not believe that it's practical to have such low targets. So therefore, we decide based on experts' consensus and whatever data that we have. We have decided that 150 for those above 80 will be the target.
Right. So
And as you grow older, something else that happens, you keep adding more drugs to it. Sometimes you have 2 different types of drugs. Sometimes you have 3 types. Many people will know today they have 2 types of hypertensive medicines. Some will have 3. Some is as high as 4 to 5 different types of combination hypertensive medicines.
So at primary care level, do we see a difference now within urbanites and people living in outside urban areas of Malaysia?
Yes, I think when you're looking at heart disease per se, I think you see them more in the urban rather than in the rural.
Right.
I think we haven't really found out the rationale behind why is it so, but you definitely see more urbans having more heart disease.
So I mean, the word which is loosely used is, you know, people don't make lifestyle changes. Now, hypertension sets in when there's stress and other factors, and these factors are all apparently found in urban settings. Yeah. So what are we doing at primary healthcare level and also at your level to ensure that people are cognizant of this and not think about the medication they're going to take to help with the symptoms, but to think of lifestyle changes?
I think the first one is regular checkups. The routine checkups, then routine referrals. And people have to come as you grow older. I think the checkups, instead of seeing 1 year once, 2 years once, you have to make it more frequent, because things keep changing rapidly as we grow older. So you have to do it like in every 6 months. You don't have to go to an array of tests. You just go for the basics tests. You know, just a basic
But
blood
Dr.
test.
Navin, with Dr. Google coming into play, some of us check our blood pressure like twice a week, 3 times a week. We all have machines in our house
exactly.
Now, what are your thoughts on these machines that we're getting off the pharmacies?
I completely don't recommend them because they are just a guide.
You heard it here on Medical Today, yeah?
Okay,
Do you agree?
So I've got a different opinion on that.
Right.
I advocate blood pressure readings at home.
Yeah.
So just get a good machine. I would recommend some brands. And to do blood pressure monitoring by yourself at home twice a day, it is for awareness of your blood pressure.
Yeah, but when you're aware, you also become hypochondriacal. I can see where it's coming from, but I also know where you're coming from. So where do we find that balance? Some of us become hypochondriacs, or we don't know how to use these machines, although they're fairly easy to use. Putting on a cuff is always a trick. If you put it on too tight, you get a different reading. So where do we find that center line? For those of us who have bought machines, like, why is Dr. Navin saying this?
Okay, if you look at behaviors of hypochondriacs, okay, they have frequent clinic visits, but often they are the better ones.
Yeah.
They are the ones that will live longer, although they are worry more about their health, but they actually they are very aware of their health. The one that we are worried of is those who neglect their health. And hypertension is a disease without symptoms.
Right.
You can have a blood pressure of 160 over 90 or 160 over 100 without symptoms. How else can we know? How else can we unmask this disease, but not from a blood pressure recorder?
Yeah, but a lot of people, okay, I'm digressing now, but a lot of people also say, oh, if you're having head pain here, you may be having hypertension. A lot of, these are theories we come up with as lay people, and I'm sure you've heard them. But, when it comes to the blood pressure, no blood pressure machine, now I'm for the no blood pressure machine for some reason. But having said that, let's talk about arteries for a while.
Right.
Okay, arteries stiffen as we grow older.
Yes.
How does it happen? Why does it happen?
This is a process called atherosclerosis.
Okay.
Atherosclerosis means your vessel becomes hardened. It's Latin. That says arthro means your blood vessel, sclerosis means heart. It's a process that occurs over many, many years due to fatty livers, oxidized, free radicals, high blood pressure. It results changes in your muscles around the of the arteries, and they become hardened. And arteries should relax, dilate, and contract so that you can manage patient's blood pressure. So it becomes a normal blood pressure. So whenever you need higher blood pressure, it can contract. When you have a lower blood pressure, it can relax. Now, when it gets older, your vessel that is lined all with this cholesterol or these plaques and calcification, it becomes like a lead pipe. And
so
that
it hardens.
hardens. So it has no capabilities of contracting or relaxing.
Right.
And this is the reason why, as you get older, your diastolic blood pressure becomes lower and lower.
Because of the hardening of these.
It doesn't have the compliance anymore.
So to ensure tensility, there are many things that can be done. But that being said, what is the best test to check for heart problems, Dr. Navin?
The routine checkup, like what we said, every 6 months, if they can come and see the doctor and get your blood pressure checked and get your blood tests. Basically, 6 months is what I would say after the age of 60 for someone who's
right.
Yeah.
So for girls and guys, men and women, who are more, which of us are more prone to heart
I
problems?
think there's a 10-year gap between the men and the women. Men are about
Good news, doc.
men actually get heart disease 10 years earlier compared to women, and 7.4 out of every 100 men actually have a heart disease compared to women. Women started at the age of 55 and above, whereas men started at 45 and above.
So we've got two people who are here who are specialists in your fields. Now, you always talk about primary healthcare, and I think that's the way the country is going. That's the way Dr. Zul wants it to go to within the Ministry of Health. Now, you get people coming up to you. Are they referred to by primary healthcare practitioners, or do people just come up and see you and say, I've got heart problems, I want you to check me out?
So my place is unique because the University Hospital always operates on its own. So we do not have a feeding clinic like the Ministry of Health. So we have private GPs that refers us cases, and but majority of our patients actually walk in. Since we are situated at the junction between KL and PJ, so a lot of PJ folks comes and walk into our hospital. So it's like a district hospital, sort of. So we get a lot of walk-ins. So this is where our source is. So we can see the spectrum of the conditions that we have in a suburban area, and we have noted a lot of changes recently.
At what point in your practice do you look at a patient and say, hey, I need to refer you to a cardiologist?
I think on the primary care level, you're only doing provisional diagnostics. You listen to the heart rate, by the heart murmur, you check the pulse, you look for arrhythmias. We can only come up with a provisional diagnosis. The devices that primary care have is very limited. So we always count on referring. They are the logical, cardiologists, I call them the logical healthcare providers. Healthcare leaders. So they will be the right ones. So because at the primary care, you pick and choose all the right ones and then you refer it to them. Because as you grow older, things change rapidly. And that's one of the reasons why I said the 6-month follow-up after the age of 65 is very important.
A quick question for you, Prof, before we take a break. We've got about 60 seconds left before we take a break. Do you think primary healthcare providers should have better diagnostic tools?
Yes, of course. Yes, of course, definitely. So because they are seeing a bigger group of patients. They are the ones that will be screening all these diseases before they come, and then they will choose the right ones to be sent to me for further tests. So without these tools, they will end up flooding my clinic, which already is probably most of the time turns out to be normal. So we should invest in this group of patients.
You can't sell every chest pain to University Hospital.
Well, we're going to take a short break. When we come back, of course, we're going to talk about who is prone to heart disease. Now, a lot of us, it depends on what our genetics are. Some of us are more predisposed to heart disease than the rest of us. So we're going to find out a little bit more about these things as to who is prone to heart disease. When we come back, right here on Medical Today, stay with us. We've got an interesting dialogue happening right here in the studios.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Astro lenses go beyond my correction. Their Creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never tired dragon eye. Eyezen.
Ask your eye care professional. See more, do more. Essilor.
Hello and welcome back to Medical Today. There was a time when Ellen and Indy from the Comedy Court used to talk about, they used to do this doctor skit and talk about heart problems. Said the best heart doctors in the country are Indians. Then Ellen will say the best heart patients in the country are also Indians. Now, that being said, you know, a lot of us, different races are predisposed to different diseases, yeah? Now, heart disease, everyone knows, Malays and Indians, we have a problem with it, yeah? We're always predisposed to all these things. Now, who is prone to heart disease and heart attacks? You know, after years of knowing these things that lay people now know, what other information do we have other than this?
Okay, if you talk about ethnic groups, you are right. Indians are more prone. One out of 4 or 5.
I thought it was Indians and Malays.
No, it's Indians.
Oh,
they
wow.
top. Followed by
Champions. Dr. Nawin? Go on, celebrate.
Followed by the Malays and the Chinese.
Chinese.
Chinese are spared from this heart disease. So that's the other one is male and female. Diabetes, hypertension, hypercholesterolemia.
I'm going to be a journalist and ask a very simple question. Why?
Why Indians?
Ah.
Why Indians? I think it's got to do with your diet, I guess.
Yeah.
The diet and also the lipids. Yeah, the lipids. Somehow they carry the
Can
genes.
further simplify what lipids are for the rest of us?
It's the cholesterol that you have. So the cholesterol can be from your diet. And Indian food, you know how it is. It's rich in coconut milk, and so those things are rich in.
Do you agree or disagree with him?
Yeah, I do. I do agree with him. You
But
get to see a lot of
Indian
them.
cooking also is changing. People are now cognizant of the fact that a lot of coconut milk in your curries are not good.
Yeah.
These things are changing. Do you see, a significant drop with regards to this in your?
so.
No.
Don't think so.
No, we're hoping for a yes here, but all no's are coming up.
Just only yesterday, a patient of the age of 25, male Indian, just passed away on the table.
Right.
Oh, my cardiac care problem, massive heart attack.
35.
25.
25.
About to get married next week.
Wow. Sad,
It's
huh?
so scary. It's no longer the older age group. It's in the 20s.
So it definitely is a lifestyle thing also, yeah, Dr.
Yes.
Navin?
That's
your
why
thoughts?
you should start and take care of your heart all the way. Then you can reach the 94.
Right.
As our Prime Minister is.
Right.
So you can.
So
then you
taking
gotta
care of the
start.
heart, there's just lots of studies being done, lots of surveys, lots of different outcomes in different journals. A lot of them don't see eye to eye too. But what would be the simplest go-to standard for those of us who are a bit afraid as to how our heart fares or our heart problems moving forward?
Okay, so this is where you have healthy living and a lifestyle that you need to adopt. So it's basically you have to watch your weight. Yeah. You have to be
So
in
you
your ideal weight.
Remember your girth.
Yes,
Okay.
your ideal weight according to your height. You have to watch. You have to watch your diet. Okay. So here the pyramid that we have is most likely not correct. We have the pyramid.
But I
base
guess
is
when
carbohydrate.
people come to see you, they are a bit more frightened than when they see family medicine practitioner or primary healthcare, because they take it for granted. My doctor said this. Okay lah, I'll go back and try it. But do most of them take the advice?
It depends. You got to see them frequently.
Right.
Frequency of seeing. The problem is the primary care right now is too congested, so they don't see it as frequently. The time spent by the physicians or the doctors is very limited. So the only way you can change that, you need a lot of counseling. You need to spend time with them.
So is
especially
it
when
suffice
you're
to say-
older.
Yeah. So is it suffice to say that in primary healthcare, you need to understand psychology and the psyche of
Yes.
people when you talk to them?
When you talk to them,
in
yeah.
order to strike the fear of God into them at times, you need to be able to do that at times.
Yeah, a little bit. At the
Yeah.
same time, a little bit of trust.
Yeah.
And you need, because as you grow older, your patients are also very limited.
Mm-hmm.
So like what he was mentioning just now, when they come to see him in the clinic, their blood pressure gets much higher than what it is. More than white collar syndrome is the time you wait to see a specialist.
Right.
So now the thing is, how do you actually shorten all that? So how do you know that the diseases are controlled properly? Seeing them more frequently will be one good way of doing it.
Very interesting indeed. Now, moving back to the heart and the size of the heart. As we age, they say, I don't know if this is true, our heart shrinks. Is that true?
The muscle shrinks, yes, but the heart shadow actually starts to increase. It is a compensation mechanism that happens when your heart muscle starts to die off bit by bit. So it becomes bigger and bigger to accommodate more blood for it to pump out. So although the heart muscle shrinks, the heart enlarges actually. And this, when the heart is bigger, the risk of dying is higher. Yeah.
So as you grow older, you know you've lived a decent life. Now, how do you know that something? What are the telltale signs, straight off the bat, that something's wrong with your heart? If I'm sitting at home, going about my usual thing on a daily basis, and this is open to both of you, and both of you have different takes on this, I'm sure. Yeah, or different ways of seeing it. Yeah.
Okay, how about you answer?
I think the simple one would be chest pain, sweating suddenly, sudden onset of sweating. I think the one that's really answering is difficulty breathing. When you start walking a few steps, have your shower and come out, you find it difficult to breathe. These are the simple ones that you should go and seek help immediately, rather than keeping it, because it takes a long time. A study was done. People with chest pain take about 180 minutes before they go to the hospital thinking it's a heart attack, because they always think it's digestive, it's dietary problem, some other problem. Then only the door to needle time actually
Right, which
kicks in.
leads us to the million-dollar
Yeah.
question. How long from the time you have a heart attack should a person be sent to the hospital? They say the fastest, okay?
Yeah, the fastest, yeah.
Within 15 minutes, 10 minutes?
Whichever, if you can reach, the faster the better.
The faster the better.
Yes. So there's no like within, we have time, let's wait 5 minutes. They say 5 minutes, right? No such thing.
Right.
The faster the better. Yeah. Because each time is myocardium. More time you wait, more muscle you lose.
Right.
More likely you will die.
Right.
That's
So-
one of the reasons why AEDs have been now placed in all the common areas and public spaces.
Right.
So you should have it in all the common areas as Malaysia is aging
Funny you
slowly.
should talk about this, because we have a video on AEDs and how you use them. That's going to be coming up later on the show.
Oh,
But yeah, AEDs are
very
the way
important
forward. Yeah.
thing.
Are you
'Cause-
advocating for this?
Yeah, I am, and I think everybody will agree that it's a good thing to do,
Yeah.
because there is also arrhythmias. Just now we were discussing something on arrhythmias.
Yeah.
Maybe Prof can elaborate a little bit more on arrhythmias.
Apart from what you have mentioned about chest pains and breathlessness, another thing
Yes.
to watch out is palpitations.
Palpitations.
Yeah, that's
palpitations.
arrhythmias.
As you get older, when you have palpitations, it's not really a good sign, because it means that there's a funny rhythm that is going on in your system. And the one arrhythmia that occurs regularly and more frequently as you get older is a condition called atrial fibrillation.
Okay. Atrial fibrillation.
Yes.
Yeah. Okay.
Atrial is the top part of your heart. It goes into, it fibrillates, so it doesn't contract effectively. Now, why is it so dangerous to have this? It's because it increases the risk of stroke 6 times more than a normal individual.
Right. So once again, let's just go through atrial fibrillation. This is your heart, the top of your heart. If it starts to
it starts to wriggle, it doesn't contract. So it gives out irregular pulse. So it can become fast, it becomes irregular, and the danger of this rhythm is that it predisposes to stroke. And if you get stroke from these conditions, they are often deadly.
People with atrial fibrillation sometimes have syncopal attacks too, and they just suddenly faint, and then they recover, and then they just kind of ignore it.
Right.
The thing is, they just suddenly happened.
But I think for all the good work you're doing, and I mean, just let me know if I'm wrong here. There are a lot of people who are now saying that you go see a cardiologist or you go see a primary healthcare doctor, and they give you medication for the rest of your life. You really need to look at alternatives and how you can change that. But I'm guessing whatever decision is made is based on risks being weighed here, isn't it?
Yes.
When a person is given medication, because a lot of people now say, especially, and I'm not generalizing, within the Western world, a lot of people say, oh, we should go to holistic medication, we should go for alternative treatments because Big Pharma wants to make money, so on and so forth. That aside, with heart problems, once you're given medication lifelong, the risks have already been weighed by your cardiologist and your primary care.
Yeah.
Yes, and what earlier we discussed, we were talking about as you grow older, above 60, you have other predisposing conditions that come in, diabetes, hypertension.
Right.
I think as a cardiologist, he will tell you a little bit more of how complex the whole situation becomes when you want to treat cardiology by itself.
So let's talk about NCDs now on a whole.
So diabetes is our biggest enemy right now, and especially in Malaysia, it now has reached about 17.5% of the total population. So that 1 out of 6 has is a diabetic, and having diabetes shortens your life 6 years. If you have a diabetes and heart attack, it shortens your life 12 years.
Wow.
So that's life expectancy in Malaysia, it's only about 70s. We are not Scandinavia yet, which is all in the 80s.
Right. So it is very scary when you put it that way. It is very scary.
And somehow Malaysia, we do far worse than the rest of the South Asian.
So at this point, people are talking about a sugar tax. Should we not? There's many things happening on the periphery to make sure we cut down on our sugar intake. But is that it, just cutting down on your sugar intake? Or is there a lot more?
It's lifestyle.
It's lifestyle.
You're too sedentary. Our carbohydrate.
Can you all please stand up, boys?
Yeah, why not?
I'll show you. Work on it.
Anyway, our carbohydrate intake is what we eat, how we burn it. We don't have that culture that we see where we exercise often. We don't do that very often.
So your takeaway for this would be, for those of us who always always want to lead an unhealthy lifestyle, but always worry about having a heart problem, what would be your advice to the rest of us?
Okay, so
me included.
Yeah, it all starts off with what you really want for yourself, and try to avoid starting medications by doing simple lifestyle modifications. Exercise more, eat better, eat less carbo, more greens, more proteins, and check your blood pressure regularly. And that's what you do.
Get a good machine.
Get a good machine. Weigh yourself regularly. And that alone will delay whatever disease that may come or may not come at all.
Right. Every week on the show, we've got something very interesting. Dr. Navin has a takeaway. He'll come up with some acronym of some sort, or some rhyme. What do you have for us this week?
Okay,
before
heart,
we take a break.
H-E-A-R-T.
Okay.
So heart is basically holistic. You got to look at it overall. Start with your dental, the teeth, the eyes, the whole thing. Exercise. You got to be active.
Correct.
And then you have to look at things more, the approach of care, and active mental health. You have to have that. And lastly, you have to have routine, regular checkups. Routine. See, as we discussed, as we get older, we like a routine. We like something more stable, something more specific. And the last one is time. You need to spend time for yourself, and the doctors who see you must spend time too.
Right.
So that will keep all the heart well.
Okay, once again, HEART. Very quickly, let's go through that again.
Holistic.
Did you remember
Yeah.
that? Yeah.
Holistic.
Exercise. Approach for active health.
What's that?
And then R is,
I can't remember.
R is routine.
I'm getting dementia.
Yeah.
And time.
You have routine, and the last one is time.
Time. Yeah.
Yeah, with the remaining 1 minute, what do you have to say? How are you going to wrap this up for us, Prof?
Okay, so don't think that you only get sick when you're old, because those things
That's
doesn't
a good
happen.
thing,
Yeah, it's catching up on you. So if you're not aware, it will just spring up one day and you end up with a heart attack or a stroke, and that's it. Your life, you will suffer. So don't think I'll leave this at the end. Okay, I have time to enjoy. Let's enjoy now. There's no such thing.
It
It
can
starts
happen
now.
to anybody.
It starts now, or it will never start.
Right. Professor Dr. Imran, Dr. Navin, was a pleasure having you on the show. I had a lot of fun. I thank you very much for coming in and talking about heart health and, of course, well-being. I'll remember heart. We will try to figure out that acronym as we move along. Thank you very much, doctors. When we come back, we've got more for you right here on Medical Today. Stay with us. This is Medical Today on BNC.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Astro lenses go beyond my correction. Their creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
Hello Malaysia and welcome back to Medical Today with me, Jared Ratnam. We certainly do hope you have been enjoying the show thus far. Now in segment 3 of the show, we talk about erectile dysfunction for all ages. Now if you're a man, you may someday face this problem or you might be facing the problem now. Whatever the case, a lot of us face these problems. Apparently, erectile dysfunction affects up to 30% of men between 40 and 70 years of age. Now, our on-site host, Nurata Amin, spoke to Dr. Han Pei Kwong, who is a consultant urologist for the Regency Specialist Hospital with regards to erectile dysfunction for all ages. Let's take a look at that interview.
Erectile dysfunction, or ED, which used to affect people in their 60s, is now affecting the younger generation in Malaysia. On Medical Today, we have Dr. Han. Thank you for joining us. So, Doctor, what is ED?
ED, erectile dysfunction, is inability to achieve or maintain an erection. You need a good vascular system, you need a good neurological system, you need an intact hormonal system, and good psychology for it to happen.
Right. So is impotence a form of ED?
Impotence is a fear of all every male in this planet, I would say. It's the most severe in the spectrum of ED. When a patient comes to seek treatment for ED, we will assess them. They are mild form, moderate form, and severe form. Severe form means complete inability to achieve erection.
Okay, so in Malaysia, which race is affected the most by ED?
In Malaysia, we don't actually have a large population-based study to reflect a true data, but there are quite a few smaller studies carried out by single institute. For example, the UMMC, the University Malaya, they found to have Indian population seems to be the highest age group, racial group to have these problems. That mostly related to their higher risk of having cardiovascular disease and also metabolic disorders.
All right, so besides that, what causes ED?
Causes ED go back to our modern society, where nowadays the westernized lifestyle means we have problems of hypertension, diabetes mellitus, and also hypercholesterolemia, the so-called modern disease. With this kind of problem, it makes our blood vessels to have problems. If you look at ED, there's two mechanisms. One, we need to pump the blood to the male genitalia.
Okay.
Second, we need to keep the blood there. So if you got disease that affect the blood vessel, then you don't have enough blood or your nerve is not functioning well, you can't keep the blood there. Therefore, we cannot have a good erection.
All right. So how do endocrine diseases affect ED, and what are the diseases?
When we say endocrine factors, we are talking about male hormone, testosterone. Okay. Testosterone is essential for our daily life. We need them to have our stronger bone, stronger muscle, and of course our sex drive, our libido, the desire to have sex, and also the mentality and all that. In the recent years, the AUA, the American Urological Society, have a huge hoo-ha about this, because the treatment for low testosterone actually is injecting testosterone. They found out that this can lead to a higher risk of a cardiac disease. Therefore nowadays we adhere to a strict criteria of which kind of patient we should give hormone injection, because to diagnose a person to have low testosterone, hypogonadism, the symptoms are very vague. It's like you are feeling tired all the time, you are not focused all the time. And then the clearest indication of giving the injection is not there. So now we need to have lab confirmation you do have low hormone before we can give treatment for that.
Right, you did mention about neurological. So maybe you can explain further about neurological and nerve diseases.
Yes, the most common example would be diabetes. With poor control of sugar, with long-term disease, your nerves slowly get damaged. When you have damaged nerve, and then the same problem I mentioned earlier, you can't keep the blood in your male genitalia. That's why you have ED. And diabetes is the worst cause to treat in the ED. They respond less well to all kind of treatment. So, and Malaysia actually has the highest obesity rate in Southeast Asia. We are among the fattest in this region due to most likely our lifestyle. So that our ED rate, our heart cardiovascular disease problem is also the highest among the region.
Okay, you touched a bit on cardiac previously. So how about cardiac-related conditions that affect the heart?
We know for a fact that actually ED predicts a risk of cardiac arrest by 2 to 3 years. Why? Because again, this is a blood vessel problem. With all those metabolic disease, your blood vessel get thickened, get clogged up. That's why you got heart attack. And they affect your male genitalia first. That's why you have ED first. And as a urologist, we play the role of looking after men's health. Most men, you know, is notorious to come to see doctors. Therefore, when they come to see us for this kind of ED problem, this might be the only chance we can advise them to seek cardiac screening to reduce the risk of getting heart attack in the future.
All right, so besides screening, other facilities that will help in the long run?
In the long run, of course, you need to adjust your lifestyle. There's no secret to it. Everybody knows what's to a healthy lifestyle. That means eat properly, sleep properly, exercise more, and all those things that we need to promote our life. It's just that whether you have the persistence to practice it.
The discipline.
And the discipline, yes, that's a correct word.
All right, let's get a bit personal. How about emotional disorders like depression and anxiety?
ED will impact your confidence as a male because it's the main function representing manhood. Of course, you will have major psychological effects such as depression or that. And on anxiety, it's actually a very, what we call a vicious cycle. If you get more anxious, you actually perform less well. It's anxiety, performance anxiety, what we would say. To tell a patient to relax is the worst advice you can give him. Nobody can actually relax when you just tell them to relax.
Right.
So with the proper treatment, we look at re-establishing confidence so they can address this performance anxiety.
Right, doctor, we can see that what used to be an older man's disease is now affecting teenagers. Why is that?
Because those metabolic problems are affecting younger age group. So younger age group people got problems, diabetic, hypertension earlier in life already. Therefore, they have ED. But on the other end, urban lifestyle means we have more stress. I mean, who don't have stress? Everybody has stress. But stress will affect your performance. And then your lack of sleep, too much distraction, you need to check on social media all the time. Unhealthy lifestyle and all that will affect your psychological desire and the ability to perform. Not like last time. Last time when it's like maybe in the farming society, lights out at 7, so you don't have any other activities. But now lights out late night, it can extend until people sometimes sleep 1 or 2 o'clock. They will lose the time and the desire to have a proper SI.
All right.
So that all plays a factor.
Could family history become one of the factors?
Family history is not so important.
Okay.
Yeah, but there's a subset of younger patients have this problem. What we call tonight is the night syndrome. That's when a young couple trying to have children, the wife will plan the menstrual cycle and they'll tell the husband, okay, we must do it tonight. And that kind of pressure bring on that make the male unable to perform. Sorry to say, male are more susceptible to stress than female partners.
Right. Okay, as we know, Malaysians are generally very shy not to open up and discuss about this issue because it has much to do with how we call it macho-ness. So what would you suggest for us to break this barrier?
Sex obviously is a taboo in our society. In fact, we don't talk about it openly.
Right.
But the problem is if people are not educated, they look to other sources for information. They go to internet, this is street vendor, they look for other sources to get a treatment, which can be harmful. So I would suggest better education for them to seek proper channel of treatment. The other part is the partner. Partner is the intimate partner that should look into this issue and try to encourage the partner to come to see the doctors.
And probably maybe for younger generations, maybe their parents or...
I don't think our society, they will discuss this problem with their parents.
Right. So how would you advise probably the potential younger patients?
Younger patient, a lot of time is more, like I said just now, it's more of a psychological issues things.
Okay.
Because if you have a normal vascular and neurological issue, you shouldn't have this problem. But of course, everybody is different. We should look into other factors about this.
All right. So doctor, what are the treatments for ED?
Okay. First line is always the drug treatment, which is the Viagra. Everybody knows about Viagra, the blue pills, the magic blue pills. It's been around for us for 20 years already. Its effects is well known. It works. Of course, a lot of people have this fear whether they can grow dependent on the medication or not, whether this can be harmful to their life or not. But obviously, if you seek treatment from a proper doctor, they will advise you accordingly. Then second line treatment, if Viagra and those drugs doesn't work for you, is device. device, we have vacuum device and injection. They actually works very well. But the problem is a lot of people discontinue from their use because they are cumbersome to use. You need to prepare beforehand. There's no spontaneity. You can't say I want to have sex now and go ahead. And the partner need to be understanding. That's why the dropout rate is high. The third line of treatment is what we call a penile implant, a prosthesis. Most commonly used in patients after prostate cancer surgery, where the nerve is damaged, then they can look for implant. Less commonly for just a primary ED patient. Now there's a new form of treatment coming up because all these Viagra and all those things treat the symptoms. They do not reverse the underlying problem. The new form of treatment is called shockwave therapy. Right. The mechanism is stimulate the blood vessel, so you got more blood flow to the male genitalia. So it's trying to look at the underlying cause. It's not involving surgery, so it's painless. It's not involved taking pills, so it's another form of treatment which is coming up now. It's available in my clinic.
Therefore, doctor, is ED curable?
Yes, I would say it's positively yes. But in this age of personalized medicine, every patient has different needs. Every patient got different expectation. We need to come up to tailor the patient needs to meet his requirement to come up with a proper plan. But I do have to ask that seek proper treatment. Don't go to internet or straight vendor for other things. For example, our national Tongkat Ali actually is a rich source of male testosterone inside. But that by itself, if you take too much, it can be issues. So definitely there's hope for ED patient.
Okay. So that's the good news. And thank you for spending time with us on Medical Today, Dr. Han.
That was Nurata Amin, our on-site host, speaking to Dr. Han Pei Kwong, a consultant urologist from the Regency Specialist Hospital. Of course, they spoke about erectile dysfunction for all ages. Now, there's a lot of information out there with regards to erectile dysfunction and a lot of people who are in the know as to what's happening. Now, if you're shy or coy about talking with regards to these things, please tell a friend first and get someone to, of course, point you in the right direction. Always. In the meantime, stay with us. We're going to take a short break and come back with our accidents and incidents video right here on Medical Today. Stay with us.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never-tired Dragon Eye, Eyezen.
Ask your eye care professional. See more, do more. Essilor.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
Hey there, thanks for staying with us right here on Medical Today. This is the final segment of Medical Today, and as always, on a weekly basis, in Season 2, we talk a little bit about accidents and incidents, or to be exacting, we bring you a video on a weekly basis. Now, today we're talking about an AED or to be exacting, it's an automated external defibrillator, apparently a sophisticated yet easy to use medical device. Now, we have a first aid video for you with regards as to how you use this, and this was brought to you by Makota Medical Center, Malacca. So let's take a look at this video and come back and give you a little bit more information about the show right here on Medical Today. Take a look at the AED video.
Today, I'll be demonstrating 3 basic steps of using an AED. The purpose is actually to start the heart for a person who is collapsed or eventually no signs of life. So what are the basic 3 steps? The first step will be switch on the machine. Second step, apply the pads. Third step will have to be waiting the machine to actually to shock the person or not to shock the person. The machine you use will be actually a voice prompted, and you instruct you throughout the whole way, when you're doing CPR. So the first thing you're going to do is you're going to on the machine.
Unit okay. Stay calm. Check responsiveness. Call for help. Open airway.
You're going to apply the pads.
Check breathing. Attach defib. Don't touch patient.
Do not touch the patient.
Don't touch patient. Analyzing. Shock advised.
This is when
Don't touch patient. Press flashing shock button.
Clear.
Shock delivered.
Press the button
Start CPR.
to shock. Subsequently, you're going to place your hand in the middle of the chest, right? Interlace it, and you're going to start with CPR. Continuous compression until the ambulance arrives and the personnel eventually comes to take over.
Continue CPR.
That was a little something about an AED, which is also known as an automated external defibrillator. I know that's just too much for you to keep in your head. Automated external defibrillator. Well, if you can't just keep this in your head, 999. Dial them first before embarking on any emergency or first aid tasks. On that note, we'd like to thank Makota Medical Center for the AED video. A job well done. Once again, I'd like to remind you, call 999 during emergencies. Now, if you do have any questions for me or for us in the team, do send us an email. Send it to ask@medicaltoday.my. That's ask@medicaltoday.my. And we'll be more than happy to facilitate any interview you'd like us to have or to talk about any subject matter whatsoever. Please send us that email. Once again, it's ask@medicaltoday.my. Next week on the show, episode 9, sees us speak about the respiratory system. We'll be talking to Dr. Ashok Philip, he's a consultant physician, and Dr. Wan Haniza, who's a resident consultant chest physician. Both of them are from Makota Medical Center. They'll be joining us right here on Medical Today. On that note, I'm Jared Ratnam signing off. You have a great day ahead and a fantastic week. Bye-bye.